Good evening. I'd like to share my thoughts with you regarding the Christ Hospital Cardiac CTA Angiography course which I recently attended. I'm a practicing, busy interventional cardiologist who recently has adopted a practice in coronary CT. I was already level 2 certified when I attended this course, so I was somewhat familiar with the type of course being provided. There are many offerings out there today that physicians can avail themselves of. Unfortunately, not a lot of them provide very personalized tuition. In particular, the number of live cases provided in many of these courses are a severe failing to many physicians who attend. A lot of these cases are logged onto hard drives and provided for home review. While this is beneficial, nothing is as efficacious as looking through a study with a trained interpreter and actually using the software required for interpretation in front of that expert and showing him what you can do and have the expert also demonstrate to you how better to improve your skills. It's tuition of a kind that you don't get any other place. I am pleased to tell you that I was very satisfied with this course. It's very intensive, it requires a lot of effort, but over the 4 days you accumulate a fantastic wealth of knowledge. The way the course is set up involves watching at least 60 live cases. Many times, many of the physicians stay over for even more cases and accumulate more than required numbers for certification. The beauty of the course is that one watches the case in the CT scanner, discusses with the CT technicians, the radiology technicians, the pros and cons of different acquisition protocols, and then you walk right across with the data and interpret it with the physician expert. The physicians, Dr. Pelberg, Dr. Mazur, Dr. Clark, and Dr. Swazluk are excellent interpreters with a vast amount of experience, which is very obvious when one reads with them. What is more, they're practicing clinicians, so a lot of this is interpreted in a manner that's very familiar to practicing cardiologists and radiologists. Lastly, the wealth of clinical material presented is enormous. The libraries that I was able to go through in 2 days, I wouldn't think that I would be able to accumulate in a practice lifetime. So for all those reasons, the quality of personalized tuition, the number of live cases, the continuity between observation and interpretation, as well as the wealth and depth of the cases demonstrated to us, as well as, I should say, the snags of interpretation, the pitfalls, the artifacts, which are very important if we're not to overcall lesions or undercall lesions for that matter. And because of this experience, I feel very confident leaving this course that I've obtained an excellent background and a level 3 knowledge at this point to confidently approach and supervise my hospital's CT program. I'm sure as time goes on, this hospital and Dr. Pelberg and colleagues, Dr. Mazur, will undoubtedly be providing us with more courses as the technology evolves. One last thing is the opportunity to see the latest technology in action. Many of us have 64-slice CT scanners in our community hospitals, but not 256 and 320-slice scanners. So the opportunity to see the quality of data, to discuss with these experts what represents the next best incremental investment in technology is invaluable. And the chance to see these scanners in action, to ask the really important, hard questions as to whether this technology is worthwhile or not, is in fact a superb opportunity which should not be underrated. So I hope you have fun at this course. I certainly did, and I think it's worth every cent of the money. Thank you.